Parkinson's disease is a progressive neurological disorder that primarily affects movement. It develops gradually, sometimes starting with a barely noticeable tremor in just one hand. While tremors are common, the disorder also commonly causes stiffness or slowing of movement. Symptoms. The symptoms of Parkinson's disease can vary from person to person, but they generally include tremors, shaking, usually starting in a limb, often the hand or fingers. Bradykinesia, slowness of movement, making simple tasks difficult and time-consuming. Muscle stiffness, stiff muscles can occur in any part of the body and can limit the range of motion and cause pain. Impaired posture and balance, posture may become stooped, and balance problems can occur. Loss of automatic movements, decreased ability to perform unconscious movements, such as blinking, smiling, or swinging arms while walking. Speech changes, speech may become soft, quick, slurred, or hesitant. Writing changes, it may become hard to write, and writing may appear small one. Causes and risk factors. The exact cause of Parkinson's disease is unknown, but several factors appear to play a role, including genetics. Certain genetic mutations can increase the risk of Parkinson's disease, though these are uncommon except in rare cases with many family members affected. Environmental triggers. Exposure to certain toxins or environmental factors may increase the risk of later Parkinson's disease. Age. The risk increases with age, and it typically starts in middle or late life. Sex. Men are more likely to develop Parkinson's disease than women too. Diagnosis. Diagnosing Parkinson's disease can be challenging, especially in the early stages. There are no specific tests for the disease, so doctors typically diagnose it based on medical history, a review of signs and symptoms, and neurological and physical examinations. Imaging tests, such as MRI or PET scans, may be used to rule out other conditions. 1. Treatment. While there is no cure for Parkinson's disease, treatments can help manage symptoms. These include medications. Drugs like levodopa, which the brain converts to dopamine, can help manage symptoms. Other medications can mimic dopamine or prevent its breakdown in the brain too. Surgical treatments. Deep brain stimulation, DBS, involves implanting electrodes into a specific part of the brain. These electrodes are connected to a generator implanted in the chest that sends electrical pulses to the brain and can reduce symptoms. 1. Lifestyle changes. Regular aerobic exercise can reduce symptoms. Physical therapy focusing on balance and stretching is also beneficial. Speech therapy can help improve speech problems too. Living with Parkinson's disease. Living with Parkinson's disease requires a comprehensive approach that includes medical treatment, lifestyle changes, and support from healthcare providers, family, and friends. Joining support groups and staying informed about the disease can also help manage the emotional and psychological impact.